right. Everybody, welcome. Happy, what is it today? Monday?
Yeah.
Monday. It's a slow day, so we are injecting ourselves. That's what happens. The economy is slow, government's shut down, so patients are a little hesitant and they're staying home, so our staff are all doing stuff to each other today. Lucky them. So what we're gonna do is a little bit of augmentation for our beautiful MA's cheeks. I'm gonna point out what we're gonna do. So I actually pointed this out to her today. I was looking at it going, you know, this area is looking a little drawn down. If you look, you can see here is the eyelids, here is the tear trough, but then this cheek trough junction is kind of drawn down on both sides. And lighting can be better or worse. And maybe in certain lights it's not too bad, certain lights it's worse. And then this cheek fat pad cell here. Now, if she was older, she's very young, I would say we need to get this to come up. We need to kind of lift everything. She's way too young for lifting. She needs volume. So the volume needs to go in this area. When you volumize this, the cheek looks higher, fuller, better. Now, anytime you tell somebody I want to do cheek volume, the first thing to do is I don't want to look fat. This is the opposite of fat. It actually is going to make you look more contoured. Fat is down here. We're not putting anything down there. You should never put fillers down here. We're going up here. So we're going to suspend this basically like a cheek lift, just with fillers though. Now, as you lift this up, the smile line starts to look better. The marionette starts to look better. We only brought a couple of syringes. We don't want to go crazy. She's here, she works here. I'm going to see her on a weekly, daily basis, so I may add a little bit later on. But if you're flying into town for this, if you're flying in, and we have a lot of patients that fly into town for this, you need a little bit more volume. You may need 3 or 4 syringes, maybe even a little bit more, to kind of get the ultimate result. Because we're going to lift this up and potentially still add a couple drops to the smile line, still add a couple drops to the marionette. But today we're focusing on this cheek trough groove right here. So watch the technique, don't stop videoing. You're going to see it happen. Now, Tiffany, our lovely assistant, is going to be on the other side. What we do is a little bit of icing. So a little bit of ice on her cheeks for distraction, cheek down. You want to put your head in anatomic position. I've seen a lot of injectors inject patients completely flat. Well, guess what? When you're flat, all this stuff falls, gravity falls, you don't see what's happening. I want her sitting perfectly upright. In fact, I want her head tilted down a little bit more, like this, because that's when I get to really see this cheek trough groove. Okay, ready? So she did no numbing. Typically, we put a little bit of numbing for patients. She did do no numbing. Now look at the direction of my needle. Come in, zoom into the direction of my needle. Do you see this? It is completely vertical down to the bone. Vertical down to the bone. I did no aspiration. I didn't aspirate. Why? Because I'm vertical down to the bone. There is no blood vessels on the bone I need to aspirate. Look at people on Instagram. Look at all these videos. People are being taught the wrong thing. People are going to courses, paying $10,000, $15,000 and being taught the wrong thing. They're injecting the cheeks like this. That is the wrong thing. Do not inject the cheeks in this way. You can go intravascular. Don't worry, nothing's gonna happen. You can go intravascular, and at the worst case scenario, but best case scenario, you're weighing down the cheek. You're putting the filler in the wrong place. It's got to be on top of the bone. It's like a cheek implant. It goes on top of the bone, lifts and pushes everything up. If you go in this direction, I'll use my fingers. If you go in this direction, you're actually not putting in the right plane. So super important point. Close your eyes. Let's keep going. Vertical. Look at this. Vertical down to the bone. I'm feeling the bone. I'm putting the material right on top of the bone, and I'm drawing out as I come out. You can literally see it. Like, it's amazing that what one little here. Hold on, I'm not done yet. I only did a third of this, but let me show you. Watch this. Take a look. Look at the right versus the left.
Oh wow.
Right?
It's really different.
I mean, it's like really, really different. I barely did anything. I mean, it's just, we're not even done yet. But it made such a difference. So that's not even half the syringe yet. We're going to keep going a little bit more. No, we're going to keep going. No, just going to stay. We're going to ice this side. Close your eyes. I'm walking the needle. Go a little bit more medial. Again, I'm down to the bone. I don't need to aspirate. I know exactly where I am. Take another look. Which side looks more rested? Yeah, Correct. That's how much more rested. Now, switch with me, Tiffany. Put the ice on that side. I mean, you can totally see the contour. If you look at 3/4 view, if you come around the camera, look at the 3/4 view. Look at this contour. It's a nice, smooth contour. This side falls in. This side was doing that, but now it's kind of doing this nice contour. And we only used half a syringe. Not 10 syringes, not 15 syringes. I'm not going crazy, just half a syringe in the right place. All right, ice here for me. Tiffany, ice here for me. Cool. Okay, we'll be there. All right, keep going. Right down to the bone. Vertical, straight down. I'm feeling the bone. I'm not skiving it. This is not like these online courses you see. And as I'm seeing it happen, look, I'm watching. End result is I'm watching what I want to see. When I see the right result, I pull out. Right there, that's gone. That depression's gone. So what's my end result is what I'm seeing. I'm not distorting it. She's not laying down. I'm not moving her face around. It's just perfect anatomy. She's sitting right there exactly as she sees herself. The filler goes in exactly as I want it to be. Is my face in this thing? Okay. So that's how I want you to focus on. Small needle, no cannulas, no cannulas. Keon, Karimi, I love you. He was my resident, he was my medical student 20 years ago. I love him to death, but I don't like cannulas. They're not precise. You don't know where they go. Cannulas go in the wrong direction. We use cannulas for fat because fat will not go through this. So when I do fat injections, it's going through cannula, not through this. But this is a 31 gauge needle, extremely precise. It puts the filler exactly where I want it to go. All right, let's keep going. I'm gonna go a little bit more here. Again, straight down, right to the bone. I'm feeling the bone right there, periosteum. This is a supraperiosteal injection. And I'm seeing the results. I'm not distorting it. I'm watching to see how much it plumps. Then I pull it out. And that's where I am. How painful is this? Is it terrible? You crying?
Not at all.
There's not a little tears coming, but it's, you should have known. You didn't know. It's all right.
It really doesn't hurt.
Okay, good, perfect. So, a little bit more. Close your eyes. When they close their eyes, things relax a little bit more. I'm gonna be right there. Feeling the bone. I'm looking for end result. The end result is where I want to be happy. I don't want to poke her a million times. I want to get the right drop. Now, you've heard of me talk about microdroplets. This is not microdroplets. When I do nose injections, it's microdroplets. When I do lips, microdroplets. This is not micro. I want to have the least amount of injections, but in the right place at the right depth. So if I'm top of the bone, if it's going to act like an implant, it doesn't need to be a microdroplet. It's actually a pretty large globule, but it's going in the right place. That's how we do this. Cool, take a look.
Very refreshed.
That's it?
Well, yeah, it looks very good.
All right, cool. I have a little bit more left. Let me see where I want to put it. Let me look straight up. Put your head back for me. Tilt your head back. Tilt your head down now. Let me see your helicopter view. All right, I mean, you're really symmetric. You don't need this. Put your head back. I'm really happy with this. You know what? Smile lines. Let's use it in smile line. Yep, here.
Please.
It's just not enough, but this side's deeper on her. So what I'm gonna do, I'll wait for Tiffany to come around, put a little ice there. So we're gonna go to the piriform aperture right here again. Look at this one, straight down. It's going straight down, right there. Again, it's not microdroplet at this area because it doesn't need to be. There is no risk of vascular occlusion when you do that. Done. So, 1 syringe, that's all it took. Sometimes it takes more, sometimes it takes less. But in the right place, no bruising, she did great. And again, we'll do this again. This is not going to last 5 years, but the stuff that we did there will be there probably up to 2 years. But every 6 to 8 months, you want to do a little bit more to maintain it, to augment it, to add to it, to improve it. So that's what you're going to do, right?
Mm-hmm.
Cool, awesome.